You can't keep complaining or being upset about something that you have the opportunity to change.
You're tuned in to Leadership Beyond Burnout, where we encourage you and your organizations to heal, lead, and succeed. I'm your host, Dr. Kimberly L. Wilson, and I want to welcome back all of our fired up friends. And if you're new here, make sure that you listen for all of our actionable steps that you can begin to integrate into your workplace and your life, as well as some challenges that can help you as you go along in your day. Feel free to send us questions to us or to our guests. If you'd like to contact us after the show, feel free to go to drkimberlywilson.com. Today's episode is going to be sponsored by Jenkins Public Health Consulting. Let's introduce you to our guest today. Today we have Brittaney Jenkins. She is a public health practitioner and certified health education specialist. She has over a decade of experience in healthcare and public health. She is the founder and CEO at Jenkins Public Health Consulting, a woman and Black-owned consulting firm located in Alabama. JPHC supports nonprofits and businesses nationwide operating a health program, service, or initiative related to chronic disease or injury prevention. She provides consulting, workshops, speaking, online courses, and workforce development resources, including executive coaching and internships. Her firm offers a 5-step framework and specializes in program development, capacity building, community engagement, and social marketing, while infusing health equity and health literacy in every aspect of their work. Without further ado, please welcome Brittaney Jenkins.
Are you ready to take your organization and its programs to the next level? I know that tracking program outcomes, building trust with communities, developing marketing strategies, and leveraging resources through capacity building can take ages and sounds overwhelming just thinking about it, but it doesn't have to. Use our 5-step community impact framework to improve your program's performance and outcomes. The best part is, this is something you can use over and over again for all of your programs, even if your strategic plan changes. With 12 years of experience in public health, directing programs and managing funding at the local, state, and federal levels, I know a way to increase participation in programs, address hesitation to behavior change, and methods to establish new partnerships for your public health or wellness program. Do not go another day, month, or year struggling to take your program to the next level. Let me help you using the 5-step community impact framework so that you can use innovation to motivate your staff and take your program to the next level. It's time to use a framework that supports your organization and the community. Hello. Thank you so much for having me. I'm super excited to be here.
Thank you so much for being here. I'm pleased to have you, and I'm so excited to get into public health because I don't believe that many people understand what it is. And before we get to that, please share what you do to bring healing to the world.
What I do to bring healing to the world is really helping organizations build trust with communities so that these programs, these prevention programs, like chronic disease and injury prevention programs, can really help to improve or maintain good health of people nationwide. I like to say one community at a time. So really, implementing programs that are improving health outcomes.
So you're sort of the middleman behind the scene, or middle woman behind the scenes that makes all of these grand ideas and promises that public health and politicians make. You help them to put them into action and get the best outcomes. Is that right?
Yes. I love to be a part of that implementation phase of the programs. There's also a lot of programs already existing. And so if they're already existing, I help to assess the effectiveness of those programs so that when they go to implement, they're highly effective. And that we get the people in the seats or the programs or the resources that they need. So again, they can have an improved sense of life, well-being, health, etc.
Okay, so in a way, if when public health organizations, they have this idea in their head that isn't birthed yet, you help
Mhm.
them to deliver the baby and help the baby kind of grow up and be a viable program to the community.
Absolutely. And you know what? So before I even started as a consultant, I worked in nonprofit, but now being a business owner, it's helped me to really see the bigger picture of when you're creating new programs or products, when you're looking at the sustainability of things long term versus just, not focusing on a grant season or a grant period, which sometimes is only a year or 5 years, but we're thinking long term, right?
Right.
And so I believe my business sense has really helped to be an asset to organizations to develop sustainable programs. And to your point, even if they haven't been developed yet, I'm a certified health education specialist and have been able to help organizations assess, develop, implement, evaluate, and then re-implement based on changes and feedback from the community or other stakeholders. So yes, from the beginning stages all the way until programs have already been established.
Now, I'd love for you to share because you dropped a little nugget in there that I really want to bring back when you talked about not just grant season. So, because I believe
Mhm.
that some organizations, because I was in a nonprofit organization, and sometimes they get that one grant, and then everything is focused around like, how do we get that grant back? And you might not get
Mhm.
that grant back, and you
Right.
might need to broaden. So, I'd love for you to share like why that would be a fallacy to focus on just a particular grant.
Yeah. I actually have a quick snippet on YouTube about how grant funding is limited and that organizations shouldn't just focus on grants to survive. But, thinking about the larger picture on why you're applying to that grant and how you can continue to, put yourself in a position, your organization, your community, because we need community champions to also champion for us to continue this funding. But why we need this long term and think about other grants or partnerships, or again, I talk about capacity building, how that can extend the life of those efforts even beyond that grant, right? So maybe that grant funded isn't provided the next year, but there's still efforts that can continue without that grant. And that's what grants are supposed to do. They're supposed to really just help you to build on your current programs or initiative, but not to help solely drive that. And I think that's where I see a little bit of misunderstanding when it comes to why you're not getting a grant and why this program can't exist. Well, it was supposed to help you to be sustainable, not to only, support that grant in that period of time.
Right. And correct me if I'm wrong, a lot of the grants that are coming out uh, focus on like collaborative efforts rather than,
Mhm.
hey, you drive the bus and let's see how far you can get with that bus.
Yes. And grant funders really appreciate collaboration on grants. There are grants where it's only awarded to one agency, but at the same time, they depend or expect agencies to have partners that are helping to bring awareness to this grant, bring people to the benefits of that grant, right? If they're implementing a program, our partners are going to help bring people into the benefits of this program. And so I've seen large organizations. I just posted about this on LinkedIn, or maybe it's going to post tomorrow. I saw an organization lose $60,000 worth of grant funding in just one grant season, right? That
Wow.
fiscal year from one of their biggest funding agencies because they lack partnerships. Great
Mm.
program, huge need, funded for decades, but they had the same partner that they've had for decades, no new ones. And even the people, on their board were unengaged. And so they look at those things, right? Because there's a lot of other programs that are really trying hard to survive and thrive, and those funds need to be put towards that effort. And so those are some things that agencies should be thinking about when it comes to sustainability in their funding, their partnerships, and community.
So one of the things that when you were talking about that and the loss of that grant, and I'm curious, does any of that happen due to just burnout and people not wanting to look and feeling drained, like, oh, I have this great program, but nobody's using it. And they just feel this lack of self-efficacy to be able to create any change. I'd love to hear your
It's
thoughts.
hard, some of the comments I hear is that, we've been around for a long time. Everybody should know about this already. Well, so has Amazon, so has Google, so has some of these big brands who have to market every day to people to get their attention and to say, hey, stop, look at us. This is what we're doing. This is what we want to give you, or, we want you to buy from us, whatever the goal is. And so when you're any type of agency, nonprofits aren't always small and they're not always, limited budgets. But they need to be aware of how they're amplifying awareness of what they're doing, what their needs are, and the outcomes that they're making for communities. But marketing is an issue. Research states that agencies are wasting about 10% of their marketing budget due to ineffective marketing practices. And then you're mixing health in there, so it's making it even more complicated because 90% of adults are not health literate. And so that's why we're seeing low engagement, low participation, subpar outcomes of programs and initiatives.
Right. When you said ineffective marketing, my immediate first thought was those mailers that I get that end up in the trash can immediately. I've been to places and there's this huge trash bin filled with nothing but all of the mail marketing that comes in. Nobody wants that.
Yeah, yeah. And one thing I talk about is building a persona. And that's usually business talk. And when I'm talking to these health organizations, they're like, what's a persona? A persona is that customized profile of the person or the community you're trying to reach. And so when they create that persona, they know exactly who they're trying to reach, where they spend their time, what are their challenges, what are their likes and dislikes and preferences. And you can create your persona based on different types of research, focus groups, needs assessments, and stuff like that.
So how does Brittaney Jenkins get into public health? Like,
yeah, I like the way you did the little shimmy.
Because I said I know there must be a story of why you decided like this is gonna be my baby. This is my passion.
Yes. My initial desire for working in health was being introduced to it by a member of my church. I was probably a young teenage, maybe 12, 13 years old, and I had the opportunity to job shadow in the hospital in the pediatric unit. And then it just went crazy from there. I mean, I was doing nursing programs. It was like early nursing programs, and I think I was about 14 years old. Worked in hospitals and college and rehabilitation centers. But it was in that moment that I realized most people are at hospitals or in these situations due to preventable causes, chronic diseases, injuries that could be prevented. People were dying, disabled, had diseases. And I said, how can I be a part of preventing this? Because I realized that was not the type of environment that I could work in. I'm too emotional. I have a heart for people. And seeing people die around me was not good. And so I changed my career path to public health, was able to transition and use my transferable skills to get into public health. And I haven't looked back. I believe I have been working in public health for about 9 years, and the rest of my 13 years is healthcare, something like that. But public is a passion, and I want to make sure I can do everything to help organizations and individuals get people access to the programs that they need, get the funding or capacity that the organization needs as well, and then, educate people and eliminate barriers to access. And barriers isn't always about transportation barriers. It can be mindset barriers too.
Right. Because there are still a lot of people in many communities that will not go to seek medical care or even to get a basic checkup or find out information. It's like pulling teeth to get my adult son to go to the doctor.
Yeah, for sure. I mean, there's gender differences that, some guys are more likely to not go to the doctor. I can't say some, there's a percentage of that group. But also, being aware of those social determinants of health and how you can address them. If my health professionals are listening in, I'm sure you've heard of the health belief model. And it's all about perceived susceptibility, like how susceptible am I to getting diabetes? How, susceptible am I to drowning, around all of my friends? And people have, who thought they were not susceptible, obviously have been diagnosed or even died in situations that they thought they were completely safe.
Mm.
Overcoming some of those mindset barriers to susceptibility, which is one piece of that entire model, is huge. And how I actually help and encourage organizations to frame their marketing and communications and programs, because that's where you really see a bigger impact.
Getting in there and changing the belief.
Yeah.
So it's not only, hey, we're here and this is what we're doing, but really getting in there and like, hey, you need this.
Yeah. And the thing about it too, we're health professionals and we are big on research and numbers. 1 out of 10 people, they don't resonate with that.
Mhm.
And so how can we dig deeper with our communications and the way that we're talking to them so that we say, hey, look, this could happen. What are we doing right now? Or what are you doing to prevent this right now? Right. I'm not perfect. I have a big love for ice cream. Okay. And I'm a chronic disease health educator and I have an ice cream bar at the house. Okay. But
So
it's
ice cream
important
is not a health food? Is that what you're saying? It's not.
to be healthy. They have dairy free options but once you start putting all the toppings on there, it kind of gets out of hand. And yeah, I have all the toppings.
So even with your knowledge, like there's some things that I still want.
Yeah, we all have our thing, I think, and it's really about thinking about long-term health, right? Like, what are you doing now that will harm or benefit you long term, right?
Right.
And that's why I do think everything in moderation, depending on what you're talking about, that's in moderation, because some things are not good in moderation even.
Right.
But yeah.
So when we talk about collaborations between entities in public health, I'd love for you to share like what are some of the success stories and what are some of the challenges that occur when creating collaboration.
Collaborations. Yeah. So I will say that the most type of success that I've seen is when, and people hear this all the time, when you have your community a part of the process. It's called multi-sector partnerships. I hear a lot of organizations talk about cross-sector, and the difference between cross-sector is that cross-sector only includes other organizations a part of those partnerships.
Right.
It doesn't include community. When you are doing multi-sector partnerships, that includes the community in every aspect of the work that you're doing. You're getting their feedback. They're helping to champion these initiatives, these programs. They're volunteering. That helps with your capacity as well.
Right.
Oftentimes we think of the capacity only as funding and staff, but it's so much bigger than that. It is our partners, our engaged and active partners. It is our community, our champions, and those who are willing to volunteer. It is our interns who are actually trying to build on their skills to be successful in the workplace and, perhaps even work for the agency in the future. So there's so many things to that. So successful partnerships come from that. And those who aren't doing that, they see a lot more challenges. They're a lot more burnout. They're wasting a lot more time because maybe they don't have standard operating procedures that make them more efficient with their time. And, tracking performances measures that show what's working and not working.
I can't tell you how many meetings I've been in as a part of community mental health, let's just say back in the day,
Mm-hmm.
where there are a bunch of professionals sitting around. There's the board of directors, there's the person from this entity, from the state and that entity, not anyone with mental health issues in sight. And we're talking
No.
about what's effective and what's going to bring the most change and how can we serve better.
Yeah. Yeah.
And we have our theoretical and experiential knowledge, but not that of those in the community.
Yeah, that burns me up. And that's why I started Jenkins Public Health Consulting, really, because I was tired of seeing generalized community outreach, community engagement, not enough people at the table who were actually dealing with these experiences. Gratefully, I had the opportunity to serve the community as an employee from a health department and helping them see, like, from that community-based level, how we can build trust with these communities. So that's why I started my company. And I was just at a summit, and they were talking about food security and, healthy
Mm,
eating, and there might have been 5 community members in there. You couldn't tell really, but it was all mainly professionals of other health organizations who had esteemed titles and, Fortune 500,
right,
CEOs. It was crazy. I'm like, if this is for the community and it's free, where's everybody at? You know?
right,
And that's what we need to focus on, because they know exactly where the things need to be implemented. And I'll give you an example. I was doing a pedestrian safety project because injury prevention is part of pedestrian safety,
hmm,
and grand, amazing idea that was funded. We had multiple amazing partners a part of it, and we included the community. But what we did, what made it more effective, was that we had the outcomes. We knew where the high crash zones were within the county, and where we were planning to make changes, the community members were like, no, let's go down this street so we can show you exactly where the problem areas are. And that fully enhanced the outcomes of safety, reducing crashes. It was so successful. And that's exactly why, right? We
right.
have these community health needs assessments that's telling us what's going on in our community. But when it's time to implement that program, you need to make sure like it's fitting the needs of those communities, neighborhood by neighborhood, zip code
Wow,
by zip code, street by
right.
street.
Because they know where the accidents are about to happen.
Yeah, because they've seen it. We might work in those areas, and perhaps a few of us live in those areas, and likely you're not doing the work in the same exact area that you're working. You know what I'm saying?
Right.
But yeah, that was one of my most profound experiences. I've had a lot of fun experiences in public health.
Have you had any instances in public health or in your work life, personal life in general, where you've felt burnout and you had to create a recovery journey for yourself?
Hmm. Burnt out. I think I don't think I was necessarily burnt out in corporate. Was I fed up? I think there's a little bit difference, because burnout, I feel like I wasn't excited to do this work anymore.
Okay.
That I was kind of giving up on it. That's what I feel about burnout. But fed up was like, I'm not seeing the results that are possible, and I need to do something about it. I
Mm.
don't think I've felt burnout in my personal life. I don't think so. I don't know. I'm always striving to like keep a positive mindset and even track different themes in my life that are happening. Like, am I always running late? Am I always doing this? Like, okay, so what are you going to do about it? Right? Like, if you're not happy, what are you going to do about it? Are you going to soak in the unhappiness, or are you going to soak in the happiness? Like,
Did
yeah,
you just tell me that you are tracking your own outcomes?
I did. And I don't really like write things down, but
Okay.
I try to take mental note. Like, okay, you can't keep complaining or being upset about something that you have the opportunity to change, right?
Mm.
Like, if you want to play big, then you have to be on time and be ready and be this, that, and the other, So I don't know. I'm not perfect. Absolutely. I have definitely many downfalls, but I don't think I've really experienced burnout from what I can think of.
Okay, beautiful. Do you
Yeah.
have a routine that you engage in to really reduce stress for yourself? Because I imagine these, when working with different entities, that there are a lot of high stakes going
Hmm.
on. There's money to be lost. There's health not to be
Yeah.
had. So how do you stay resilient?
Yeah, how I stay resilient. I really enjoy podcasts. I really enjoy the communities. Like, I'm in a couple communities of mothers who are also business owners, and they have multiples. So getting out with them and really just letting things, like putting business to the side and really not talking about business for a period of time. So putting things to the side, having boundaries, like work life boundaries is what I call it, instead of work life balance. Knowing when to turn things off and know that, hey, tonight is not going to change anything to get it submitted tonight, or maybe it's just simply too late if we're talking about grants. But I think it's the balance and the boundaries that I've been really diligent on, especially now becoming a mom. I don't want to be that person where my child is waiting for me for hours when I have the opportunity to be there for her, and things can wait.
Wow. I love that you said that. I just before you, I was talking to a young mom, and she thanked me for asking her a
Mhm.
question about herself. She said, "You reminded me that it's okay to think about me, that I can have a life." And I was
Yeah,
just like, wow,
that's
it
so
is
good.
easy to forget when you're in the
Yeah,
midst of raising
yeah, yeah.
children and taking care of people.
It is. And I will say, like, schedules for her work really well. I don't really have a routine or a schedule. I don't like to be dedicated other than to my clients or like something that, dealing with people that, work wise. But I don't really have a routine for anything. And that might sound bad, but I know
Oh,
what really where we need to be and at what time and things like that. But my child has a routine. And so she gets the proper rest and so that we are energized, you know what I'm saying? She's not up all night and day. She's 2 years old and she still takes naps on weekends, she still goes to bed 7:30, 8 o'clock every night. And she's good with that. She's happy with it. And so I think that's what energizes me. And my household, my husband and I, we really do focus on trying to give each other that time to relax. And, he just came back from Texas and it was a work trip, but I'm sure it was very fun. He had a nice little experience out there. So that was his time to reset, things like that.
okay. So while everything else for you is very regimented, you have things you're doing for yourself, you want to flow a little bit more and
Yeah,
take
because the
things as
business
they
is
come.
super regimen. We have all these processes and methodologies, and I'm like, okay, that is super regimen, and I know exactly what's happening there. But like, that's my time outside of like business to kind of like fly by the seat of my pants.
Okay, now I'd love to hear about your secret sauce, this five-step framework that you use,
Yeah,
if you can tell us, or maybe a
yeah,
piece of it.
I can say a piece of it. Yeah, I can say all of it. I mean, you can hear about the framework, but do you know how to implement it? That's the thing. So I'm happy to share framework. I love it. And, we've used it for organizations across the United States. And really, it's to infuse health equity at every step. So, step one of the framework is to equip staff and stakeholders. And we talk about bias and empathy during that framework, and including other methodologies in that. But really, at the heart of it, of equipping staff and stakeholders, is overcoming biases and stereotypes, having empathy, because research has shown and outcomes are clear that with biases, it could interfere with access, giving people the access that they need to improve their health. It has led to delayed health outcomes or delayed uh, testing for people who might have cancers and so forth. And so I think it's an essential component. The second step of it is to track performance. So some agencies are over tracking and some agencies are not tracking enough. And
Mm,
then there's also agencies that are only tracking exactly what the grant funders are saying for them to track, which leaves opportunity on the table to highlight what's really happening for their partners in the community.
right.
Third step is to build capacity. My favorite and really the most requested area of the framework. And that's how we can build capacity for our programs. What can we do with what we have? Who can help us make it happen? And capacity building is more than funding. Um, it's a multi-layered thing. The fourth step is market effectively. And so health literacy, understanding things about the digital divide. So that community of people who don't have access to the internet for whatever reason, some is by choice, others not so much. So making sure we have our marketing and communications effective. And then the fifth one is my favorite is community engagement, which we call impact communities. And so how can we have effective community outreach and engagement that is beneficial to the organization and the community? Because a lot of organizations don't realize they're wasting tens of thousands of dollars per staff member on ineffective activities related to community engagement. There was one agency I did a training on that for a pharmacy, and we quantified the cost, and I think it was about $36,000 per staff member. And they weren't there yet. This was something new for them, and so we were forecasting during that training, and blown away. Right? Some people don't see it because it's not coming out of the budget, but there's indirect and direct costs related to that number.
Right, right. Kind of
Yeah.
like when I buy, I keep buying large fries and 2 chocolate chip cookies, and then like, what do you mean this outfit doesn't fit?
Yeah.
Well,
Yeah.
you're not paying attention to the cost.
Right. Yes. Yes. And I mean, there's just so many other things like doing the same thing over and over again, but you're not tracking how much you're putting out and why you're doing what you're doing. You're not setting goals. And so some of those activities that can be automated, and that can save time. So effectiveness, efficiency is what I talk about.
Okay. So you really do highlight. So what is right in front of a lot of public health agencies or pharmacies, entities, they can't see. So you shine a spotlight on some of
Yeah.
those things to let them know this is urgent. You need to
Yeah.
take care of this if you want to sustain.
Yeah. And, like I said, a lot of programs are already developed. There's agencies all over. And so when I come in, I'm typically doing an audit to identify what they may have seen as a small challenge or maybe think is going really well, but there's opportunity to enhance those efforts. And sustainability, most of these agencies, I can't say most, but a good amount of them might think that they're doing really good and sustainable for years to come. But how can we extend that, right? How can we extend that beyond what you even believe is possible from having this outsider view come in and audit what's happening and give you some good recommendations for improvement?
I love that you said sustainability because that was like I was holding that question in my head was
Yeah.
I was going to ask, do you feel like sustainability and capacity building like they are two sides of the same coin?
Capacity building and sustainability. I think without capacity building, you're struggling because you don't have partners, staff, community, funding. Capacity building is a multi-layer approach to ensure sustainability, to ensure that next phase of that framework works effectively as well.
Now, I know your focus is on healthcare entities, but when I hear your framework, I hear its applicability to so many different types of industries
Yeah.
in the way that you talk about it. So I love that. Do you feel that it applies to other industries as well?
Yes, and I have to be careful because I'm like, I get so many different types of requests, and I'm like, I got to stay in my lane because that's my company's mission. This is what we're
Right.
doing and why we're doing it. So I'm mainly serving healthcare and public health organizations and businesses. There was an organization, a client I just had, we did a VIP day, and they are selling medical supplies. And I'm like, okay, that's healthcare, and that was different. I hadn't really served a product-based health organization, and very successful outcomes. And so I can definitely see it happening for many places, even like chiropractic places, but really focusing on program development, partnership development, and building trust with community so they can access the resource or, have an improved sense of understanding of their health.
Now, in capacity building, are regular hospitals, do they play a role in some of that or some of the healthcare entities that most people are most familiar with? Because I think a lot of people don't even think about going to public health unless like, oh, I need shots and
Mm-hmm.
I know I can get shots there.
Yeah, I think hospitals definitely play a role. I know they do. My thing about hospitals is like high hospital admission rates and readmission rates. And perhaps they can use their partners to further educate, which is, it's a controversial topic if we really dig into it, about hospital admission rates and why it's important to get those down to public health people. um, but I think what they utilize their partners to educate the community about what's appropriate or, what other avenues could you use before coming to the hospital. I think that could, improve health outcomes and medical costs and, even support our partners in what they're currently doing, utilizing the proper resource at the proper time, like the poison help hotline versus going to the emergency department for something that could have been treated at home over the phone by a specialist.
Right.
Calling non-emergency versus the 911 for, someone who's, on the side of the road, something like that. Just different sources of how to utilize services in the community.
So I guess for that to really work, as soon as you started talking about that, I could hear how it could be controversial because whereas you may not want your hospital emergency room flooded with and distract you from those that really need life-saving care, you don't want the hospital to go broke either
Right.
because you
Yeah.
have staff to support and you have to maintain. So it's
Yeah.
finding, sounds like you're saying it's finding a nice blend of how can we marry things and create this ecosystem of
Mhm.
care, if
Yes.
I'm understanding correctly,
Absolutely.
so that
Yeah.
the
And
community and organizations thrive.
absolutely. And I talk to hospital CEOs and talk about the integration of certified health education specialists that could actually even be in the waiting rooms with these patients, right? And educate them about what's going on. Do some of those brief assessments to see if they even need to be seen by a physician, right?
Mm,
Um, because certified health education specialists, we're not medical professionals, but there are some of those baseline things we can do for patients, which includes health literacy, health education. And so while they are sitting in the waiting room, we can even do social determinants of health assessments. To really get to the deeper part of what's going on in their lives, right? They're not just here because they're dealing with an emergency, but they're also, might not have food or shelter. And some people are actually sitting in the waiting room because they don't have shelter, and that's their excuse to get out of, the elements. My
mm.
sister's a AMT, and she talks about that all the time.
Now, I think that this, what you're saying goes back to earlier when you talked about was it the medical belief model and whether or not the community believes that these health educators in the hospital have their best interests at heart. And you give me this health educator, is it because you want to help me out or is it you trying to keep me from medical care? Or
Mm-hmm.
am I just thinking
And that's the
too
thing
far?
about the building trust, that initial phase of the framework. There is a lack of trust among the community and health professionals, whether you're a non-medical health professional or you are a physician or a nurse. There is a lack of trust. And so understanding and overcoming any type of biases and beliefs will help to figure out how you can build trust with them. And so that is a thing. And that does sometimes interfere with people getting the care that they need. But that's why we also need to do more when it comes to getting ourselves out in the community and, having a strategic way of how we're doing engagement.
Do you believe that COVID and everything that happened in hospitals, do you believe that damaged some of the public perception of healthcare or it strengthened it?
It definitely damaged, the perception of healthcare. I haven't seen any reports to say that it's gotten better, but COVID definitely played a part in more damage to that. But for the health professionals who are doing their part to speak up and use their platforms to further educate people, I think that's really helping. I don't see that really done a lot. There's a couple people I follow on LinkedIn that are medical professionals who are using their platform to educate. And I just wish that more did that so that people they go and seek the help that they need. Some people, I will just say that 60% of adults have a chronic disease.
Mhm.
And then there's even more, well, 1 in 4, I believe, are living with 2 or more chronic diseases. And so there are people probably dealing with adverse symptoms that need to be seen by a physician. And due to the lack of trust, they tend to get worse and worse. And especially people with diabetes, they end up with limb differences, well, not differences, but loss of limbs,
Yeah,
eye health, poor eye health, and so much more that could be treated effectively with early detection.
right. I'm curious, what do you believe are some of the key trust building factors in engaging with communities? And I know it varies from
Mhm.
community to community. Um, is
Yeah.
there anything that you'd like to share with the
Yes.
marketing?
Well, with marketing, there's a lot of people online. I think people really enjoy polls and ways to give feedback. And, as a data collector, right, it can be a lot to look through that data.
Mhm.
But at the same time, using different platforms to easily collect things, that helps with the efficiency of looking through the feedback from community. But I think that also builds on the trust that they say, yes, they are hearing me. They allow me to give my input. When it comes to actually community engagement, which there's different types of community engagement, whether it's a mobile unit, a health fair, resource fairs, even virtual community events. Again, asking people what their needs are, what they're seeing, asking them, what do you see in your community, right? What we
Mhm.
see might be different because we're the experts,
Mhm.
and we're the people who actually do the high level research. But what they see could be different and can provide a lot of insights on how we should address the needs or implement the program. I love trivia. I love challenges. And it's a great opportunity, again, to do surveys, so that you can know where people are coming from and why they're there and what resource might best be fit for them.
Right. And just to provide clarity, because I'm one of those people that likes to ask a lot of questions, as you can see.
Uh-huh.
Uh,
I love it.
when you're saying quantitative, you mean like, is it cancer? Is it
Yes.
injuries? Is it that or other? Instead of just saying, what do you see in your community? That's
Right.
qualitative when people
That's
just get to
qualitative, right. And so, yes,
say whatever.
quantitative, you're basically shaping the options, without being biased. So sometimes you have to be careful with that too, because you can almost try to sway people the way you want to sway them with the questions and the options that you have. I've
Yeah.
seen it, happen a lot. I can't say a lot, but I've seen it happen before and how that needs to be addressed. And that's really challenging because we know what outcomes we're looking for as a program developer, implementer, and the leader who wants to stay funded. But making sure that we're being ethical and honest in our work is huge
Mm.
for building that trust.
It would seem as if, and please correct me if I'm wrong, that uh, I believe that most people want to be ethical and honest, but there are some blind spots. Like you said,
Hmm.
the them having a specific grant. Are there any other type of blind spots that you think
Hmm. I
contribute
think,
to bias?
yeah, I mean, there's 170 different types of biases. I mean, there's beauty bias. There, I can't even name all of them, but I talk about it in the training for the framework. But those are a lot of different blind spots that we have, right? To even biases where it's like, oh, you went to West Point, oh, me too, you're hired, or oh, then you must be smart, or you must be a good person, or so there are so many ways that blind spots could affect the quality of our work, the quality of our teams, our communication, right? Because that leads to assumptions of someone that might not be true, that are mostly not true. So yeah.
And most of us don't even aren't even aware that we have
Right.
all of these blind spots. Uh,
Yeah.
So, as we begin to wrap up, I'd love for you to share with the audience if you have any specific challenge or thing that you think might be helpful for their communities or their personal lives to move
Yeah.
forward in terms of public health or health.
Absolutely. I'm really big on being a part of your community. Um, Volunteering. Organizations need more volunteers. And whether they have a call out for it or not, looking in your community and seeing, okay, which organization would you love to be a part of to support? Or even take it a step further and look for a coalition that you would love to be part of change, right? I was the former chair of Smoke Free Indy Coalition in Indiana, and there were people from the community who would just show up to our meetings uninvited. And I believe in the power of numbers. When more people come together, you see change. We can't do it alone. We need your support. So consider joining a coalition that you're passionate about. What are you passionate about? There's likely a coalition for that. And if not, and there's some needs in the communities, consider creating your own. It doesn't have to be government funded or ran. It is a community based thing. So that's the challenge.
That is beautiful. Brittany, I want to thank you so very much for being here. I'd love for you to share as well how anyone can contact you, especially those public health entities that need some support.
Yes. You can contact me on my website, www.jenkinsphc.com. That's Jenkins Public Health Consulting.com. You can follow me on YouTube at Jenkins Public Health and Instagram, Jenkins_public health. And I'm really very active on LinkedIn, where you'll find a lot of my health education tips and strategies to improve your organization at Brittaney Jenkins.
Thank you so very much for being here. I love all the nuggets and diamonds that you shared with us. Any last words before we go?
Yes. I just want to say thank you for the opportunity. This was such an insightful conversation. There's not many times that I'm able to have this type of conversation other than with another public health leader. So this has really been an honor.
And I can actually absolutely tell how much you love what you do, because you spoke with such passion and such fervor and guidance and knowledge. So thank you so much for sharing it with us.
Yes, you're welcome.
Thank you for tuning in today. You've watched Leadership Beyond Burnout. You can find us here every Thursday at 5 p.m. Eastern Standard Time.